Today, I want to tell you a little bit about something that is happening for just about half of the population. Yes, it does skew a little bit more female than male, but we want to come to you with a solution. And everything that we do just right here in Stoneham at Nutrition and Whole Health Solutions is thinking about how we can help our clients with natural pain management, natural solutions, things that are simpler, easier, non-invasive. And so this is a non-invasive solution we're going to talk about today for urinary incontinence and pelvic floor strengthening. I'm coming to you today, again, from Stoneham, Massachusetts, Nutrition and Whole Health Solutions. We're really a natural healthcare practice wellness center right here in Stoneham, Massachusetts. I'm the owner, Sarah Tugender, and I feel really strongly about helping people heal safely and naturally with things that don't involve unnecessary drugs or surgeries. And so today we're going to talk a little bit about the ReStora EMS chair. It's a breakthrough. It's a brand new thing. We're the first ones in Massachusetts to bring this to our community for urinary incontinence and different pelvic floor strengthening. And so it's FDA cleared. It's not new technology. This is just a new brand, a bit of a stronger magnet. It's an entirely non-invasive electromagnetic stimulation. So it's going to be a magnet that sits right at the bottom to you sit right on a target and you're going to position yourself. It helps to stimulate your pelvic floor for rehabilitation. It strengthens the pelvic floor muscles. It's painless. I do tell everyone it's sensational. You will feel it, but you're not feeling uncomfortable at any given time. It's discreet. We have clients who read a book. We have clients who meditate. We have clients who watch their favorite TV show on their, iPad or phone, get some things done, scroll social media, whatever you want to do. And at the same time, you're contracting that pelvic floor, restoring your muscular control, and it's treating urinary incontinence in both male and female patients at our office. So how many people have this issue? It's a medical condition. It's the involuntary leakage of urine due to loss of bladder control. It can happen during routine things. You can just cough or laugh or sneeze or even while at rest. I think too, one of the biggest safety concerns is thinking about, people who in the middle of the night may be a little unaware of their surroundings, a little off balance, and just that safety of not having that urgency of running to the bathroom. This condition affects tens of millions of Americans, 62% of women, and 14% of men. It's really who can benefit. I think it's something you really do self-identify for. You may have talked to a urologist, a gynecologist, a pelvic floor specialist, or even just a friend to say, that this is something that's happening with you. But, older women, as we get older, things are, atrophying. We don't have the same hormones, and this, different factors of hormones will make it so your muscles are going to weaken. This will increase your urinary incontinence. You don't have to live with it. This doesn't have to be that you're always in a panty liner or it depends. This is a non-invasive solution. You can regain your control and your confidence. Men, the same thing. When we think of men, we also think of post prostate surgery. It can be a really unexpected challenge, but just incontinence in general, or just a little bit of dribbling, it's kind of will be called sometimes, but just that urgency as well. Non-invasive solutions like the ReStora EMS chair help restore that pelvic strengthening and bladder control. So we think of the pelvic floor as that whole basket of muscles around the hips that keep all of our organs in the right place and keep them up there and keep them functioning properly. And so, as you're getting older and you're losing that strength and control there. What can this help with? I mean, I mentioned earlier, waking up in the middle of the night, that's called nocturnia. Dropping or falling organs, that's called pelvic organ prolapse. And sometimes, that can happen. And, the doctors will say surgery might not be the best recommendation. Recovery after childbirth, accidental loss of stool, you can have both fecal and urine incontinence. You just position yourself a little differently on the chair, but the same chair will apply. There is a whole female sexual and male functionality to it. Just the faster return of bladder and sexual health after prostate surgery. So it's FDA cleared for strengthening the pelvic floor in both men and women. Pelvic organ prolapse, it's a condition where one or more of the organs, there's the bladder, the uterus, the rectum, or the vaginal vault are going to, kind of fall out, descend from where their normal position is. It's going to bulge into that vaginal canal. And, it is a main cause of, a weak pelvic floor is a main cause of pelvic organ prolapse or POP. That it acts like a hammock, I said. And when it's weakened, and this can be from all sorts of things, just natural aging will weaken those muscles. Menopause, obesity, chronic, gastrointestinal issues throughout your lifetime that can have these organs drop down and prolapse either into or outside of the vaginal canal. Fecal incontinence, and that's another thing. It affects both men and women. It's about 8% of adults who experience fecal incontinence. It will jump up to 9%, those 60 and older. And the EMS chair uses electromagnetic pulses to stimulate that pelvic floor. It's going to be responsible for both bowel and bladder control. And the ReStora is FDA cleared for this, strengthening those pelvic floors and helping with that. So, when the bathroom is going to break your sleep, nocturia is a condition where you wake up one or more times during the night. And getting up once might be normal. The frequent times can disrupt sleep, well-being, and, weakened pelvic floor muscles are a leading cause of nighttime urination. They play a vital, role in bladder control. And so, again, we want from a safety perspective, not having people running to the bathroom. So what do you do when you come to our Stoneham office? You can sit right on the chair. It's a harmless a magnet that's right there. You can see it sits, right underneath your bottom to deliver thousands of deep pelvic floor contractions. You will feel the sensation, you will feel that, but it is doing 15,000 Kegel exercises, those contractions of the pelvic floor in just one treatment, just under 30 minutes. In a 30-minute session, again, you're going to go through 15,000 powerful contractions to tone, to lift, and to strengthen the pelvic floor. So you're doing these, 6 of them twice a week for 3 weeks. And then to maintain those results, you really should come back at least once a month if you can for maintenance treatments. Just like any other muscle, it will continue to atrophy with age. So having those maintenance treatments are going to be great. Who is not a great candidate for this? Anyone who is pregnant, has a metal implant. Titanium hips are okay, but we want to just screen for any other metal implants. An electronic implant, a skin disease, especially in that pelvic region, epilepsy, heart disease, a fever. Don't do this if you're not feeling well, or an IUD or copper coil. We do have you sign a consent form. We will go through what is involved before your first session. You should empty your bladder. You can wear any kind of clothes. You're going to stay fully clothed during the 30-minute session. And so go to the bathroom before. It's non-invasive, it's comfortable. You're in a very private room in our office. There's zero downtime. You can do whatever you need to do that next day. There's nothing that you need to avoid on the same day or after one of your sessions. Sure, just like anything, the risks are pretty minimal with this. You might have some contraction, little muscle pain, a spasm, something that feels like it's tender. There may be some redness from the treatment, but these risks, if they even do occur, which we haven't seen in our office, they're very temporary. They don't last long. So you're doing 2 treatments a week for 3 weeks, and in 21 days, people are saying that they have 95% satisfaction. That is with the machine, but we're feeling even the same thing with our office, probably even better because our screening process, we really go through to make sure we're putting the right people into a full treatment protocol. In just 3 weeks, 2 times a week, 6 times in 3 weeks, 28 minutes, you can really get life-changing results. We want to give you, really great solutions to what's going on. And we hope that you come in. If you haven't done so yet, book a trial session. The first trial session is always free at our office. We have links to be able to book, and we hope to see you soon because we want to be able to offer something to you that's non-invasive, that's simple, that's just going to make your life pain-free, make your life a lot better and easier with something that we can simply help you with. So come see us at Nutrition and Whole Health Solutions in Stoneham.